Good morning, everyone. Welcome to the MLK Exhibit Center on this warm Thursday morning. We are here this morning to, I'm here this morning to welcome you to the Dr. King Legacy Apartments, which were built in 2012 to commemorate King's fight in Chicago against housing discrimination and the history of redlining that we faced on the west and south sides of the city. So, on behalf of Lawndale Christian Development Corporation, I, Whitney Smith, would like to welcome you to our space and welcome the mayor up to the podium.
Thank you. Thank you, Whitney, and thank you, everyone, for being here. Let me also acknowledge the other leaders that are joining us here today. Chicago Department of Public Health Commissioner Dr. Allison Artery, who after all these many days probably doesn't need further introduction. Chicago Department of Health Chief Racial Equity Officer Sandy Brown. Chicago Department of Public Health Medical Director Dr. Geraldine Luna. City of Chicago Chief Equity Officer Candace Moore. Westside United Executive Director Aisha Jocko. Rush University Medical Center Vice President of Community Health Equity Darlene Hightower. Phalanx Family Services CEO Tina Sanders. Greater Auburn Gresham Corporation CEO Carlos Nelson. Swedish Covenant Hospital Director of Intergovernmental Affairs Marcia Jimenez. Northwest Side Housing Center Rapid Response and Hyperlocal 60639, that's a mouthful, Program Manager Cindy Oliveras, and Southwest Organizing Project System of Care Organizing Director Jessica Biggs. It is only fitting that we're standing on historic ground to make an historic announcement. When you ask most people about what they know about the late Reverend Dr. Martin Luther King Jr., they'll tell you about his 1963 March on Washington epic speech, and sadly his tragic assassination on April 4th, 1968 in Memphis. But Chicago also has played a big role in the legacy of Reverend Dr. Martin Luther King Jr. That's why we're here today at the MLK Exhibit Center, located in historic North Lawndale, which commemorates Dr. King's fight against housing inequality and redlining as part of the 1966 Chicago Freedom Campaign that he helped to lead. Allow me to share this important moment in both Dr. King's legacy, but also our city's history. It was during the Chicago Freedom Campaign that Dr. King and his family took up residence in an under-resourced apartment building at 1550 South Hamlin Avenue here in our city. They lived there for 6 months to expand civil rights activism from the South to northern cities. The campaign gained momentum through demonstrations and marches in July 1966. And as we students of history know, it was during one of these marches that black demonstrators were violently attacked by white residents with bottles and bricks, and Dr. King himself was struck, leading him to remark, I've seen, quote, I've seen many demonstrations in the South, but I've never seen anything so hostile and hateful as I've seen here today, end quote. Nevertheless, Dr. King did not give up the fight against housing inequality and redlining here in Chicago. And thanks to its organized activism, the Chicago Housing Authority announced that it would build public housing with limited height requirements, and the Mortgage Bankers Association agreed to make mortgages available regardless of race. Those are monumental steps at that time. Now, these announcements were, as Dr. King eloquently put it, the first steps in a 1,000-mile journey. And we're still on that journey today. We've made undeniable progress in our city. And I'm standing here today as the first black woman and first LGBTQ mayor as a testament to that progress. But no one thinks that we've gone far enough, and in fact, we have not. The journey is marked by a number of other notable events in our city's history and painful legacy around systemic racism. And it's nestled against a backdrop of a number of discriminatory policies, such as redline, restrictive covenants, racist public housing practices, and more, in what was a deliberate, intentional strategy to give groups access, some groups, access to opportunity, but pointedly to deny it to others, notably Black and brown residents in our city. And those historic practices still reverberate today. The results of these events and practices are the source of the great disparities we still see at this moment in health, wealth, and almost every other important indicator of well-being. And they can never fully encapsulate the everyday injustices that Black and brown residents, LGBTQ members of our community, and others, immigrants and refugees, continue to face. At almost every single point in our city's history, sadly, racism has taken a devastating toll on the health and well-being of our residents of color, and particularly those who are Black. And without formally acknowledging this history and reality and the continuing impact of that infamous legacy, looking at the root causes of today's challenges, we will never be able to move forward as a city and fully provide our communities with the resources that we need to live happy, vibrant, and fulfilled lives. A lesson that we learned the hardest way possible through COVID-19, when it struck our city and wreaked havoc on Black and Latinx communities. That's why, ladies and gentlemen, I am here today with racial equity and healthcare leaders to formally declare systemic racism as a public health crisis here in Chicago. When we think about racism, many of us, you can clap for that. When we think about racism, many of us think about its visible and audible forms. But the reality is the insidious nature of systemic racism has other impacts that are every bit as deep and harmful, but often ones that we can't see, like the impacts on the psyche and other impacts on our bodies that are just as, if not more, deadly. Let me frame this from a personal perspective. Racism puts a cap on someone's humanity and tells them that they're lesser simply by virtue of the color of their skin. Effectively, without interventions, destroying their perception of themselves and leaving them with lasting mental ailments such as depression, anxiety, and anger, which then typically turn into serious physical ailments. I know this firsthand from my life. Many of you know this. Both of my parents grew up in the segregated South, and they were born in the 1920s. They grew up in a country and in a land and in a region that every part of their existence was constrained simply because of the color of their skin. As Black people, they were a threat to the white rule of the day. And they had every aspect of their growing up, every aspect of their community, their humanity was defined by trying to stay out of harm's way simply because they were Black. They both had dreams that were never realized. My mother wanted to be a nurse, and my father wanted to be a lawyer. But because they were Black, and because Black success was considered an anomaly, but worse, a threat, and became a target for retaliation, my parents, like so many others of their generation and other generations, were indoctrinated to believe that they would never, ever be able to reach for and accomplish their dreams. This was and still is the case for far too many Black residents and residents of color in our city. And ladies and gentlemen, it is literally killing us. Here in Chicago, the life expectancy gap between Black and non-Black residents on average is a whopping 9.2 years. And depending on the neighborhood that you live in, that gap is even wider. Life expectancy for Black Chicagoans is substantially lower than for our white neighbors. And despite a substantial amount of education, investments, interventions, this historic lack of access to preventative health care has meant that as of June of this year, Black death rates from COVID-19 still are more than double that of white residents. And the Latinx death rate exceeds the white death rate by 76%. These sobering statistics stem from disproportionate rates of chronic diseases, born of historic disparities in medical treatment, safe spaces to exercise, access to nutritious food, the overrepresentation of Black and Latinx residents in low-wage and frontline workforces where healthcare benefits are non-existent in many instances, where employees often work in close proximity to each other and are less able to take paid time off when they are sick. And the list goes on and on. This information confirms what we already know, which is that 80% of health outcomes are due to social factors, including housing, safety, education, economic opportunity, factors every single one of which have, through our history as a nation, been impacted by systemic racism. That's why we're making this declaration today, because we can no longer allow racism to rob our residents of the opportunity to live and lead full, healthy, and happy lives. And we are working closely with the Chicago Department of Public Health and our community organizations to address these inequities once and for all. In recent years, we've taken a number of steps to advance racial and health equity, meaning that today's announcement is a continuum, an extension of those ongoing efforts to close the racial health gap. We established a health in all policies approach to the city's decision-making, including policy development and implementation, budgeting, and delivery of services. We established racial equity leadership positions and offices across multiple departments and agencies, starting with the first ever Chief Equity Officer role that Candace Moore occupies in my office, and the Chief Racial Equity Officer role at CDPH. We've also advanced data reports and tools to support racial equity, as well as fostered community co-leadership to promote equitable transit-oriented development and COVID-19 vaccine distribution, notably reflected in the Racial Equity Rapid Response Team, whose members are with us here today, that was key to our equitable response to COVID-19, vaccine distribution, and my hope is will be a critical resource as we continue to build out our post-COVID-19 community health infrastructure. As Dr. Arity will explain in more detail shortly, we have additional tools to fight against racial and health inequity. These tools include Healthy Chicago 2025, an initiative launched by CDPH last year that seeks to reduce the racial life expectancy gap with strategies that tackle the root causes of health inequities. And most recently, a report entitled The State of Health for Blacks in Chicago, which is the first report of its kind to focus exclusively on Black health realities and outcomes with recommendations for our Black residents. That report uses words and graphs to showcase how the racial life expectancy gap is driven by 5 main factors: chronic diseases, homicide, infant mortality, HIV, flu, and other infections, and opioid overdoses, in that order of priority. This landmark report was written by 5 Black female doctors within CDPH, and I want to commend those doctors on their thoughtful and powerful work. These are incredible steps forward, but folks, we all know that we have more work to do. It's going to take more than just city departments and sister agencies putting in the work to eradicate systemic racism here in our city. As residents of the city, we have to all come together and acknowledge the truth, acknowledge the past and the present, and be cognizant of and take accountability for the ways that we perpetuate racism in our everyday interactions and individual lives. And we've got to change the systems that reinforce that painful legacy. I also want to acknowledge that as we were coming here today, some of you may have heard, the U.S. Supreme Court once again rejected an attempt by Republicans to eliminate the protections of the Affordable Care Act. It's remarkable that in a time of a pandemic, these attacks continue. Stunning, actually. But luckily, in a 7-2 vote, the Supreme Court rebuffed the latest challenge to a healthcare legislation that has literally given a lifeline to tens of millions of Americans who otherwise would be without health care. When we talk about systemic racism, we need to look at those actions as well. We need to talk about what's going on in the halls of Congress, but also in state legislatures with attorney generals who, for purely partisan reasons, want to deny Black and brown and poor, but also middle income people the ability to live a healthy life and not have the burden of not having care, have the burden of pre-existing conditions that they can't get coverage for. We need to move past this moment. We need to move past this moment for a host of reasons, but in the city, we are doing what we can to stand firm, to make sure that our residents have access to the tools that they need to live healthy and vibrant lives. And with that, I'd like to invite Dr. Arwady to come to the podium.
Thank you, Mayor Lightfoot, for your leadership as we declare racism a public health crisis in the city of Chicago. For the past year and a half, you've heard me talking a lot about COVID every day, and people have been asking me, what's next? Well, COVID is not over, but let me tell you, what we are talking about today predates, is still going on, and to an extent will outlive COVID. And this is what is next for the Chicago Department of Public Health and for the city of Chicago. We've seen the toll from COVID on families who have lost loved ones, lost jobs, lost hope during the pandemic, and we've heard over and over again how COVID has been particularly devastating for Black and Latinx communities. But we have also seen the power of an entire city coming together with a common purpose to beat this virus, and we are succeeding. We're averaging just over 60 cases a day with a percent positivity of 0.8% today. But make no mistake, much of this success has come because we have taken an all-of-government, partnered-with-community approach, from mass vaccination sites to rental assistance programs to neighborhood food distribution. And throughout, we have been led by data. We have targeted resources to the people and communities where they are most needed, but we have also seen that when one community is not well, the city is not well and cannot move ahead. And now we have to bring that same unrelenting focus to another more pernicious public health threat, racism. Earlier this week, the Chicago Department of Public Health released a first-of-its-kind data book, The State of Health for Blacks in Chicago. And as Mayor Lightfoot mentioned, the average life expectancy gap between Black Chicagoans and non-Black Chicagoans in Chicago is 9.2 years and rising. And here's some more data highlighting the focus of Healthy Chicago 2025. The diabetes-related death rate among Blacks in Chicago is 70% higher than among non-Blacks. The homicide rate among Blacks is 9 times higher than among non-Blacks. Black infants are almost 3 times as likely to die in their first year of life compared to non-Blacks. Blacks accounted for half of the people living in Chicago with HIV, and the opioid-related overdose death among Blacks is more than 3 times the rate among non-Blacks. And importantly, the racial life expectancy gap is not limited to Black Chicago. We've also seen life expectancy falling for Latinx and Asian Chicagoans, even as it has been increasing for white Chicagoans. There is nothing natural about these statistics. They are unjust and they are preventable. As you heard, we have to work on the root causes of diseases to treat them properly. The immediate causes of this life expectancy gap in Chicago may be chronic diseases or rates of violence. But what causes those chronic diseases? What causes those rates of violence? And we know here in Chicago, life opportunities, from education to employment to housing, are different in neighborhoods just a few miles apart. And this is the evidence of deeply rooted social, structural, and power inequities that have long privileged white Chicagoans. And so today we reckon with this deadly impact of structural racism on the health of Chicagoans. But it is not enough for words to declare a crisis. We insist on coupling these words and our data with meaningful action. So I want to tell you about what's next and 3 commitments CDPH is making. First, we are investing now and moving forward in community solutions. When we released Healthy Chicago 2025 last year, we recognized if we're going to address root causes, local organizations know what's best to promote health and racial equity in their neighborhoods. And we've seen this play out in COVID-19. So today we're taking a major step to let communities lead the way. We've allocated $9.6 million in COVID-19 relief funding from the Centers for Disease Control and Prevention, the CDC, with more to come, to establish Healthy Chicago Equity Zones, 6 geographic areas covering the entire city that will be led by regional and community organizations. And you see the representatives of the lead organizations here. Leading in the far south is Phalanx Family Services. In the near south, Greater Auburn Gresham Development Corporation. In the north central region, Swedish Covenant Hospital. In the northwest, Northwest Side Housing Center. In the southwest, Southwest Organizing Project. And in the west, Rush University Medical Center on behalf of West Side United. And relying on participatory data-informed processes, these organizations will be creating community-based stakeholder coalitions, bringing together community-based organizations from every neighborhood in Chicago to develop targeted strategies to improve both individual and community wellness. In 2021, our Healthy Chicago Equity Zones will primarily focus on increasing vaccine uptake in the neighborhoods that have been most impacted by COVID, building on the work from Protect Chicago Plus and the city's Racial Equity Rapid Response Team. But as we continue to recover from the pandemic, these coalitions will also lead hyperlocal strategies to confront the root factors: health care and social service access, food access, housing conditions, community safety, and the physical and built neighborhood environments. Secondly, we are becoming a more affirmatively anti-racist organization. Sandy Brown is going to speak briefly in a moment about that. But we think that it's critical that institutions must work to transform from within if we're going to be serious about doing this work. And thirdly, we're democratizing our data. Because information is power, we are making investments to ensure that hyper-local data, disaggregated by race, becomes widely available by neighborhood, so that people can take action on issues that matter to them. And our hope is that soon, people will be able to talk about neighborhood-level indicators, like rates of chronic disease or food insecurity, in the same way that we've come to talk about COVID case rates or positivity. Visit the new and improved ChicagoHealthAtlas.org to get started. This pandemic illuminated inequities that have existed for generations, but we have a one-in-a-generation opportunity here to take what we have learned from COVID forward to a point of transformational change and the opportunity to achieve the healthy Chicago we all deserve. And with that, I'm so pleased to bring up Aisha Jaco, the Executive Director for West Side United.
Good morning, and thank you, Dr. Awadi, for your leadership. It is an honor to be here today with you on behalf of West Side United and to co-lead the Healthy Chicago Equity Zone for the West Side, along with Rush University Medical Center. We are also honored to serve as a hub for all of our amazing community leaders and lead organizations, including Austin Coming Together, Breakthrough Urban Ministries, Enlace, Equal Hope, Erie Family Health, Erie Neighborhood House, Esperanza Health, Myafa Redemption Project, and the Sinai Community Institute. These organizations have been on the front lines deploying vaccines and providing key resources to West Side communities since the onset of COVID-19. I am also honored to be amongst you in the space that Dr. King came to, as Mayor Lightfoot mentioned, 55 years later. when he declared that housing, banking, and employment inequities in Chicago were contributing factors to a national crisis rooted in racism. The voices and hard work of community leaders from Operation Breadbasket, the Chicago Freedom Movement, the Chicago Coordinating Council of Community Organizations were also leveraged to bring attention to and actionable strategies to quench the injustices that many Chicago residents, like my family, who moved to 18th and Central Park right down the street in 1967, encountered. Today, we stand in similar fashion, declaring racism as a public health crisis in Chicago, in the spirit of Dr. King, leveraging the voice and power of communities. This has also always been the work of Westside United. In 2018, 6 healthcare institutions, including Amita Health, Cook County Health, Lurie Children's, Sinai, Rush, and UI Health, a multitude of nonprofits, businesses, government agencies, and residents came together as Westside United to make 10 Westside communities stronger, healthier, and more vibrant places to live. With a mission to build community health, economic wellness, and healthy, vibrant neighborhoods, our aim is to decrease the life expectancy gap, which stands at 14 years between the Loop and Chicago's West Side, by 50% by 2030. We are committed to improving the region, or this region of the city, by developing, implementing, and evaluating strategies that are geared toward increasing healthcare access, economic mobility, and educational attainment for West Side residents. Deconstructing racist systems is at the epicenter of our work at Westside United. It began and continues to reframe and dismantle racist and inequitable practices that have existed within our healthcare institutions and partner organizations by redefining how we collectively redistribute wealth and resources within and outside the walls of our institutions. It is with this spirit and intentionality that we continue the work of Dr. King via our mission, via the launch of the Racial Equity Rapid Response Team, via the launch of Healthy Chicago 2025, and today's announcement of the Health Equity Zones. I'd like to remind you that on March 25th in 1966, Dr. King said, "We are concerned about the constant use of federal funds to support this most notorious expression of segregation. Of all forms of inequality, injustice in health is the most shocking and the most inhumane because it often results in physical death. I see no alternative to direct action and creative nonviolence to raise the conscience of this nature. This is our moment to act on this observation made 55 years ago to ensure that those coming behind us don't have to work to address the same inequities because of the frameworks that we are enacting and sustaining today." Thank you so much. At this time, I'd like to introduce Candace Moore, who serves as the City of Chicago's Chief Equity Officer.
Thank you, Aisha, and good morning, everyone. I stand here really proud to be with many colleagues and community leaders that I've gotten the benefit of working hand in hand with, both since I started, but certainly throughout the COVID pandemic. I'm really proud of the important steps we're taking as a city and that our words will be backed up with action. It is simply not enough just to condemn racism. We have to work day in and day out to build anti-racist culture and systems. That's why this partnership with the Department of Public Health, we've articulated key strategies that will advance and build anti-racist culture and systems. Namely, we're going to be building capacity for anti-racist leadership. That means cultivating visionary, strategic, and authentic leadership that can analyze the impacts of racial harm and inequities and is equipped to build sustainable solutions with communities most impacted by the problems. We're going to be reckoning with the impacts of racism. That means reflecting on how past racial inequalities were and continue to be produced and reclaiming our present engagements with intention to transform relationships, practices, policies, and systems that maintain these inequalities. We're going to advance strategies to operationalize racial equity. This means building our internal infrastructure for change, cultivating a will to act, executing intentional tools and strategies that are differentiated to best meet the needs, and holding ourselves accountable to producing equitable results. And we're going to be empowering transformative community relationships. That means designing fundamentally different structures of engagement and problem solving that embrace shared governance, appropriately resource groups that are impacted by the most racist structures to be key drivers in building and executing the solutions. You've already heard some of the efforts that we're taking on in alignment with that framework, and I'm proud to share a couple more from my office. So in partnership with CDPH, we will be expanding capacity building opportunities for our department and agency leaders by providing racial equity learning cohorts over the next 2 years. This is an investment into the talented leaders of our city who show up day in and day out to serve this great city. This effort allows us to collectively strengthen our muscle for thinking about the impact of race and racism in our city and strategize on ways to better support all Chicagoans with what they need to thrive. And last but not least, we're going to be taking the final steps in our co-creation process of an equity statement of principles with our community by sharing a final draft for public comment. The Equity Statement of Principles is a foundational document that serves to provide a common and unified language and understanding of equity as both a process, but also an outcome. The goal is that this statement will live to be embraced by the entire city government and serve several purposes, including but not limited to guiding the work of the citywide planning initiative, We Will Chicago, City Department strategic planning, and other city practices, priorities, and initiatives. While these are really important steps on our journey, I'll note they are just a beginning. Together, we must make a collective commitment to act toward building systems of inclusion that are able to reflect on our past, reclaim our present, and reimagine our future. Thank you, and I'm excited to introduce my colleague, Chief Equity Officer Sandy Brown.
Good morning. I would like to thank LCDC for opening the MLK exhibit for us today, as this display is a wonderful backdrop and a stark reminder of why this proclamation to racism as a public health crisis is so important in this moment. Thank you, Mayor Lightfoot, Commissioner Arwady, for your continued leadership, support, and advocacy for racial and social justice. I stand before you as the Deputy Commissioner, Chief Racial Equity Officer, which is the first position of its kind with the Chicago Department of Public Health, and was created to lead CDPH's internal racial equity transformation. Since joining the department in September of 2020, myself, alongside others, have begun the strategic planning process with the intentional focus on embedding equity in all of our objectives, strategies, and goals for the next 5 years and beyond. We will be conducting a racial equity assessment that will allow us to examine CDPH's existing practices, policies, and structures to identify inequities and remove barriers that adversely impact certain populations of our community, as we've heard today. This would include looking at our internal recruitment and hiring process in order to address the lack of Black, Indigenous, and people of color in senior leadership roles, conducting a communications audit to strengthen our external messaging, improve the ease of accessibility, and streamline navigating our website, and building internal capacity to expand our community outreach and partnerships as we work collaboratively to eradicate racism, close the life expectancy gap of Blacks in Chicago, and put measures in place to ensure all Chicagoans, regardless of where they live, will have equitable access and resources and services to live healthy lives in Chicago. Before I close, I want to take a moment just to recognize the authors of the 2021 data brief, State of Health for Blacks in Chicago, that was mentioned here by Mayor Lightfoot, and that was publicly released on Tuesday of this week, and the first of its kind for our department. Congratulations to Blair Akins, Dana Harper, Rochelle Paul Brutus, Donna Scrutchins, and Yas Simpson, members of Chicago Department of Public Health Health Equity Index Committee, for your time, dedication, and commitment. And we're so proud to have this brief have been released this week. And so if you haven't got your copy, please let us know so that we can make sure you can get a copy of the brief. And I'm going to turn this over to Dr. Luna, Medical Director at Chicago Department of Public Health. Welcome, Dr. Luna.
Muy buenos días. Gracias a la alcaldesa, Mayor Lightfoot, y doctora Arwady, y todo el team que se encuentra aquí representando todos los progresos que hemos tenido. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública. Y hoy el Departamento de Salud Pública se une con líderes de la ciudad y comunidad para anunciar una proclamación que declara el racismo como una crisis de salud pública aquí en la ciudad de Chicago. En casi todos los puntos de la historia de nuestra ciudad, el racismo ha tenido un efecto devastador en la salud y el bienestar de nuestros habitantes de color. Sin reconocer formalmente el impacto perjudicial, nunca podremos avanzar como ciudad y brindar a nuestras comunidades los recursos que necesitan para vivir vidas felices, saludables y prósperas. Es por eso que la ciudad de Chicago está declarando el racismo como una crisis de salud pública y redoblando las colaboraciones nuevas y en cursos con funcionarios de la ciudad y líderes comunitarios para abordar las políticas racistas que han causado estragos en nuestra ciudad latina y afroamericana. Hacemos un llamado a todos los habitantes de Chicago a trabajar juntos para abordar las marcadas desigualdades raciales que han resultado de siglos de racismo sistémicos y discriminación. Todos nosotros, desde nuestras corporaciones más grandes hasta nuestras vibrantes comunidades de negocios pequeños, nuestras instituciones de atención médica y universidades, debemos colaborar para garantizar que los habitantes de color de Chicago tengan un acceso igual a escuelas, parques de calidad, empleos y oportunidades económicas, servicios públicos y, muy importante, atención médica. COVID-19 destacó las desigualdades de nuestra ciudad y sociedad, pero siempre han estado allí y siempre han sido un enfoque de esfuerzo de la ciudad y el Departamento de Salud Pública. En el 2020, el Departamento de Salud Pública lanzó Healthy Chicago 2025, que significa Chicago Saludable 2025, un plan para reducir la brecha racial y la expectativa de vida y la esperanza en la ciudad, con estrategias que abordan las causas más fundamentales en las disparidades de salud. Hoy la ciudad de Chicago está avanzando en un plan de casi $10 millones para establecer zonas de equidad saludables en Chicago. 6 áreas geográficas que serán dirigidas por organizaciones regionales y comunitarias conocidas en esos lugares. La ciudad también ha tomado muchas otras medidas en los últimos años para promover la equidad racial y de salud, con el fin de abordar este importante tema. Muchas gracias y manténgase a salvo, Chicago.
Happy to take your questions. Let's start with on topic.
Mayor?
Yes, sir.
First of all, I mean, it sounds like a common sense measure. The question is, how much money will the city invest in these programs as compared to the amount of money the city is investing in policing these same communities?
Well, we have already invested really tens of millions of dollars, if not hundreds of millions of dollars, on a range of different initiatives emanating either from CDPH, the Department of Family and Support Services, or other city agencies, or from our corporate budget. You know, as we talked about, and I think the speakers really spoke to this issue really eloquently, the things that lead to life expectancy gaps, to healthcare inequities, are rooted fundamentally in systemic racism, but they manifest themselves in lots of different ways. So what we have been trying to do is counteract that history, that legacy, by making the kind of investments, whether it's in public housing, in public health, in the support services that we provide, in education. All of these investments are with an eye towards equity and really righting the wrong of the past. And we'll continue to make sure that we've got the resources that we need to make those kind of investments, because fundamentally, that's what's going to turn things around. And you mentioned public safety. Look, I'm a firm believer in treating public safety, but particularly gun violence, as a public health crisis. And when you do that, you look at the root causes. That examination leads us right back to the same places that we're talking about today. Systemic racism, lack of investment, lack of opportunity, which leads to lack of hope, despair, and violence. It is a continuum.
Mayor,
Yes,
we've heard this a lot from other cities and states in the past year, as well as the CDC. Why is this important now? And then a second follow-up to that question is, how much did COVID play a part in making this declaration today?
Well, we needed to make it now, and it's way past time that as a city we made this declaration, and we're following the lead of other cities and states that have already done so. But I want to emphasize that it's not enough to just make the declaration and talk about it. We've got to follow it up with concrete actions as outlined in the comments from Dr. Arwady, the work that we're doing on Healthy Chicago 2025, and other initiatives across city agencies to address some of these systemic issues. And a question of COVID, COVID laid bare a lot of disparities. You know, when we started looking at the disproportionate impact of COVID on communities of color, in particular, there's a straight line to the lack of access to safe, affordable, high-quality health care, and all the mythology that had been built up around communities of color's fear of the healthcare system, not using preventative care, waiting until, in many instances, way too long. Westside United was really formed as a result of seeing those life expectancy and other healthcare gaps to really demystify the healthcare system and bring people into care. So COVID brought in sharp relief all of the long-term systemic problems around inequities, but particularly around lack of access to healthcare. So we've sharpened our focus now for 15 plus months on this issue. I said at the very end of my remarks, and let me highlight it again, the work that we've done over this last 15 plus months, I gave a charge to my team from the very beginning. Let's not build temporary scaffolding. The challenge that COVID really forced us to reckon with at a much more accelerated pace than we might otherwise have is a challenge, but also an opportunity. We wanted to build partnerships, authentic relationships, but also infrastructure and systems that we could scale up in a post-COVID world and really build much more widespread but equitable access to healthcare at the community-based level. That's why we've leaned into the relationships that we develop with the folks who are here today, as well as our federally qualified healthcare centers. We've got to do a better job as a city in partnership with folks on the ground to bring people into care and really try to improve life and healthcare outcomes.
Were there other on-topic, because mine are, I didn't know.
Anybody else on top? Go ahead.
Okay. Elected school board.
Yep.
Obviously, it isn't what you wanted. The governor this morning says he plans to sign this. Do you see a way to perhaps make some changes?
Well, I think you also have to look at the very end. The sponsor in the House filed a motion to reconsider. that puts the bill on hold. And we already reached out, and we plan to continue negotiations, actually real negotiations for the first time over the last couple months. So I do see a path forward. We've got to address some of the obvious deficiencies in the bill. If you watched or listened to the committee hearing yesterday morning, also the questions that were put to the sponsor on the floor last night, there were a number of things that were identified. The size of the board, 21, where the largest elected school board in the country is only 9. The fact that the 21 can set their own compensation without any checks and balances and build, not only pay themselves whatever they want, but build a huge bureaucracy, dollars that in my view should be pumped back into the system to help support the education of our children. The fact that the Latinx, undocumented members of the Latinx and other communities here in Chicago are completely disenfranchised. The fact that there's no guardrails around the amount of money that can be spent on a single campaign. We know from the experience of LA there, a single race was $1 million. That doesn't bode well for parents who are demanding a seat at the table to actually have the opportunity to get one of those 21 seats. So the fact that the bill doesn't account for the fact that the city of Chicago provides $500 million annually to CPS and climbing in the out years because of CPS's structural financial issues. There's a long list. I think all of those were identified by individuals yesterday in the committee hearing as well as on the floor. So my hope is that we will come together quickly and work on a trailer bill that we can present to the members of the General Assembly in the veto session.
Crime. There has been some incidents, 4 different armed robberies near the Mag Mile, Old Town area. The looting patrols that were on the Mag Mile apparently are no longer there. Is that right? I mean, is this, it's the age-old question. You can't have a cop on every block, but it certainly doesn't bode well when you hear of families being robbed near the Mag Mile.
Well, obviously, we're very concerned about that. We have put officers on fixed posts, both north and south of the river. We continue to have officers downtown with the lights, but we've got to do more, and we're working in partnership with people on the ground, the Mag Mile Association, building owners, other retail businesses to make sure that we're being as responsive as we can, but we've got to make sure that those officers stay in those deployments and are diligent as to what's going on in the area around them. But nobody's happy about any incidents of crime or violence anywhere in the city, and so we will continue to make sure that we renew our focus in 18 and in 1 to prevent any further occurrences.
Can I ask you, last one, on the midnight liquor curfew?
Yes.
You changed it from the 10 p.m. to midnight, hearing that there still might be some pushback. Why do you think midnight is a better compromise?
You know, truthfully, I've always thought midnight was the place that we should land. When we've had a lot of conversation with business owners, and what we're balancing, as I've said before, is obviously we want to have a robust recovery for our businesses, particularly those that have been hardest hit. But we've heard from a lot of residents as well as aldermen of their concerns about quality of life. So I think midnight strikes the right balance. I mean, surely if you need to buy liquor, you can get it by midnight to tide yourself over to the next morning if that's what your intent is. But I do think that the midnight deadline strikes the right balance, given that quality of life in some areas is a real significant problem. We've seen gatherings, seen incidents around packaged liquor stores in neighborhoods on the south and west side in particular. So we're going to continue to be very diligent in demanding of those businesses that they police themselves, that they have adequate signage, lighting, and cameras, and when they see that something untoward might happen, that they're taking steps to alleviate that potential harm to the local community.
Mayor, if we can go back to the elected school board.
Okay. There you go.
Spoke to Representative Delia Ramirez this morning, and she said there's already a Senate bill they're working on that's going to allow undocumented residents across the state, a bill that would make it open to undocumented residents across the state. She also said that these board members are not going to be paid in this trailer legislation she's talking about. I mean, are you satisfied that if these things happen, that it's going to give you what make you feel more comfortable?
Like everything, the devil's in the details. There's no trailer bill yet. We're going to sit down and we're going to hammer out what the parameters of that trailer bill will be. I haven't seen the Senate bill that I think is up for a hearing tomorrow, but what I've heard from a number of Latinx educators, activists, policy folks, is that the bill does not solve the problem. We'll be weighing in officially through our Office of New Americans tomorrow, but I don't believe, based upon the briefings that I've had, that it solves the problem, and that's a shame. But again, the goal here is to come together in good faith to negotiate, talk about the strengths and weaknesses, but also the opportunities, and hopefully we will get both of these pieces, a trailer bill and something that opens up the opportunities for undocumented residents to participate in school board elections, gets them both to a better place.
Do you feel like this was a major defeat for you politically?
No, it's not a defeat for me. It's absolutely not a defeat for me. This isn't, for me, ever been about politics, ever. This is about making sure that our children and our parents have a real seat at the table, and that any change in governance is superior to what we have now. The bill that was passed is not. It's deeply flawed. You heard the commentary from the members themselves about that. That's why we're going to be meeting to negotiate on a trailer bill. But this has, for me, it's never been about the politics. I can't speak for others.
Good morning, Mayor. Many people see, we know the goal is to close the life expectancy gap between the white community and the black community, but many people feel that this is more of a crime problem and not a public health crisis, because we've had 1,702 people shot since January, 310 dead, and 80+% is black on black crime.
The homicide rate is not the biggest driver in life expectancy, and Dr. Artery can speak to that, so that's not borne out in the data. Obviously, we don't want shootings, we don't want homicides, but the biggest driver of a life expectancy gap is a lack of access to medical care, the underlying comorbidities like diabetes, health disease, heart disease. That is really the thing that is driving it. I gave you the list in descending order. Yeah. Homicide's not the number one factor. It's a factor, to be sure, but certainly not the number one factor. Okay. The data absolutely proves something entirely different.
Okay, understood. And we're learning this morning that Lurie's Children's Hospital, they have 1,800 kids on a waiting list to seek mental health, get help for mental health issues, excuse me. Is there any way that we can get some of that COVID relief funding to them and to these other hospitals around the area that need help?
Well, I'm not aware of that waiting list, but it's been clear, and I'll invite Dr. Arwady up to speak more specifically about it. COVID has had a dramatic impact on everyone, including our young people. And the fact of the matter is, that's one of the reasons why I fought so hard to get our schools open back up, to give parents the opportunity to have their kids come back into what is really one of the major social and organizing tools, if you will, for their young people, which is the school. I went to my daughter's last day of school yesterday, and there was a lot of happiness and joy, obviously, for summer break to be starting, but there were a group of young girls, probably fifth graders, I would guess. They were in tears, and they were in tears because they were going to miss each other, because they had come together 5 days a week for now months in my daughter's school, and that bond that you get with your peers, it's irreplaceable. And the absence of that for almost 2 school years, and the harm that has caused, cannot be understated. So we've got to, as we have been talking about, really attend to the social and emotional welfare of our children. It is critically important that happens. Goes back to this question of elected school board. How are we going to be dealing with the post-pandemic needs of our children? And whatever the new form of governance is, has to understand and acknowledge these challenges that our young people are facing.
And she's been back in school since August, correct?
My daughter?
Yeah.
No, she was back in school full-time, I want to say, since sometime in March, I believe.
Okay, but that's the goal next year, is to have Catholic, private, public schools back Monday through Friday.
Look, what I control and have influence over is Chicago Public Schools. We will be back. Barring some new epic surge, which we do not anticipate, 5 days a week, every week, in person. Yes, sir.
Hi, Mayor. Very nice to see you today. I wanted to ask about...
Can you just identify yourself?
Yes, my name is Pascal Sabino, West Side reporter for Block Club Chicago.
Okay.
I wanted to ask about some of the mass shootings that we've seen recently in West Garfield Park, just a little bit north of here. On Tuesday, there was a mass shooting. Sorry, getting some feedback.
That's okay.
There was a mass shooting on Tuesday. I talked to some of the residents in the area. They said that...
Are you talking about the one in Inglewood?
In West Garfield Park.
Okay.
Right around Madison and Pulaski, that corner, people say, including violence prevention groups, they say that's one of the largest open-air drug markets in the city. Lots of the residents and the business owners that I've talked to have said, there's really no recourse. We call the police don't come. There's police cruisers driving by, drug dealing happening in the open streets. And so I just wanted to ask about some of the police response to issues like that, where it feels, residents feel like there's nothing that they can do, even when they do try to take a stand.
So that's not my understanding. That's certainly not my observation. Really, for the last 2 years, what we call the Pulaski Corridor, from the Eisenhower on the south to Lake Street on the north, that is a notorious area, and there have been historically open-air drug markets. People coming from the suburbs, both by car but also by public transit, to score heroin, meth, whatever flavor you want. And in some instances, in years past, it looked like a scene out of some other country where you got runners at the train stations going up to people and asking what they want and then taking them to places where they can get that fulfilled. We have, since the summer of 19, working very diligently with the folks on the ground in those neighborhoods, been working to disrupt those open-air drug markets. Just 2 Saturdays ago, we announced what we've called the West Side Initiative, that is focused exactly in that area. Combining, of course, heightened law enforcement presence, but really working with community members on the ground there to build supports for things like green spaces, working and using Legler Library reopening as an anchor institution, the Melody School that's right there that now has a beautiful playground. But we've been there in that neighborhood intensely for the last 9 months, engaging folks on the ground. We cut the ribbon, if you were, did a groundbreaking on a roller skate area that's going to be opened up in a vacant lot. So we're investing a significant amount of city dollars, but also attracting philanthropic dollars to this very area because of the challenges. So I know Deputy Chief Cato, he's in charge of the West Side, also the commanders that are on the ground there. They know the charge. The charge is we must be responsive, we must disrupt these open-air drug markets, but we must do it in partnership with the community and build capacity in those communities so that when an area is cleared, the community has the ability to reclaim that territory once and for all. I'm going to be out tonight to the West Side to address the community related to that shooting. Look, nobody likes what's happening with gun violence in the city, least of all me. This is the thing that absolutely keeps me up every night and makes me more determined, everyone I see, to do more. But fundamentally, just as we were talking about here, when communities have been disinvested in for decades, when systemic racism is unchecked, when young people grow up not seeing people go to work every day, have a job, a real job that they can build a life on, those are the kind of root causes of the violence that we're seeing. There's no question about it. So we've got to disrupt those root causes by flooding these areas with resources, building capacity, working hand in hand with the community. But I'm going to say what I always say in this kind of circumstance, the federal government has to step up too. The fact of the matter is, there are too many illegal guns on the streets of Chicago, and we're seeing these mass shootings now everywhere. I think there's over 50 just in the last few weeks, or last couple months, across the country. Whether it's Austin was the most recent one outside of Chicago. I talk to my fellow mayors all the time, and it is the number one thing that is a topic of conversation, because without federal intervention, empower the ATF, make sure that federal licensed gun dealers are only selling to people that have a valid FOID card, not straw purchasing, make sure that those guns actually stay in the hands of the person who purchased them and not leave and get out on the streets as they do, stem the tide of gun trafficking across our borders. All of those things are low-hanging fruit. They don't have to go to Congress and deal with the vagaries of the House and the Senate. These are things that the executive branch can do right now, today, to bring better safety to cities all across the country.
Can I ask a quick follow-up on
Sure.
that? So Madison and Pulaski, the roller rink, some people in the community are saying, hey, it's inappropriate to open up a roller rink. We're going to be bringing children into a place that's, known to be a really dangerous hot spot, one of the biggest open-air drug markets in the city. And so it's kind of a chicken
I think
or
you're
the egg problem.
conflating a couple of areas, right? So the vacant lot on Madison, west of Pulaski, where the roller rink is, number one, that was done because community members told us they wanted that. So we're about building capacity and supporting the community in their aspirations. If you watch the announcement and the groundbreaking, there were 40, 50 community members representing various groups across the West Garfield Park. So there are always going to be people who criticize, but after 9 months of deep engagement with this community, we felt like we had a pretty good steer from them about what they wanted. Our goal was to provide resources to bring those aspirations into reality, which is what we've done, and I look forward to going back in July when the roller rink area opens up, but more development and resources are coming to the West Garfield Park neighborhood. All right. Thank you all.